Good morning. I'm Shawn Bennis. I'm the coordinator of Henry Ford Health System's Caregiver Program. And joining me today is Kristen Grebe. She is a pharmacist with Henry Ford Hospital. Thanks, Kristen, for joining us.
Thank you for having me.
So today we are going to be discussing Naloxone, or maybe some of you know it as Narcan. It also has another name that Kristen will be talking about of other companies that make it. So we are going to talk about the Naloxone, and Kristen's going to describe what it is, why we need to know about it, and other important things that we need to know. So Kristen, start us off. So what is Naloxone?
Sure. Naloxone is a medication that is used to reverse the effects of opioids in about 2 to 3 minutes. It's given to a person when there's a concern for an overdose to restore breathing and prevent an opioid-related death.
Well, that sounds pretty serious. So can you explain, though, what an opioid is?
Sure. An opioid is a medication or a substance that reduces pain. Opioids can be in the form of prescriptions such as hydrocodone, or you may know it as Norco, or oxycodone, and they can also be illegal and include substances such as heroin.
Okay. So what happens in an opioid overdose?
An opioid overdose occurs when a person takes more opioids than his or her body is able to handle. And the amount of opioids that it takes to cause an overdose can really vary from person to person, depending on their previous exposure to opioids, what medical conditions they have, as well as other medications that they're on. When a person overdoses on opioids, you may notice they have altered mental status, their pupils may appear smaller, you may notice a decreased rate of breathing or a decreased heart rate, and then their skin may appear different or feel cold or clammy to touch. It may also appear pale. In extreme cases, people may become unresponsive and result in death.
So unresponsive, you mean like passed out?
Yes, they may lose
Okay.
consciousness completely or just completely stop breathing.
Okay. So this is why we need to know about Narcan or Naloxone,
Mm-hmm.
right? So how can someone get the Naloxone?
Yeah, there's 2 ways you can get naloxone in the community. The first would be by going to you or your loved one's physician and getting a prescription for naloxone. The other way you can get naloxone is through participating pharmacies that are able to dispense naloxone through a standing order in the state of Michigan.
So let me clarify. So I don't need a prescription for the Naloxone, or I could get a prescription for the Naloxone?
Both. So that is correct. You do not need a prescription for naloxone. If you think that you or your loved one is at a risk for an opioid overdose, you should speak with your physician. However, if you are looking to have naloxone in your house or handy for somebody who you think is at risk for an opioid overdose, you're able to look for nearby pharmacies that are able to dispense it when requested.
Okay. So how does someone give Naloxone? I see you have some products here to maybe show us of, some different ways that you can give it.
Sure. Naloxone comes kind of in 2 different ways in the community. The first way would be through the nasal route or intranasally. And the first product is this ready-to-use form of the nasal spray. It's also known as Narcan. And then there's also a nasal kit that you would have to assemble before use.
Okay.
The other route that you're able to give naloxone is through the muscle. So the first option we have is the brand product of Evzio, and this is given similar to how you would give an EpiPen. And the second way you can have naloxone for intramuscular is through a kit, and this again would need to be assembled before administration.
So I'm assuming the person that passes out or overdoses wouldn't be giving this themselves. So this is important for caregivers to know.
Yes, correct. So it's very unlikely that somebody who actually overdoses on opioids would give this to themselves. So it's important to not only let the people you live with know that you have the product, but also where you store it and how to give it in the case of an overdose. Paramedics and police officers are often being trained to give naloxone, and of course the emergency department is able to give naloxone. In the case that you do give it in the community, it's important to call 911 immediately after giving naloxone.
Okay, so even if the person comes to life, so to speak, right? So they're not passed out and they're actually coming back, we should always call 911.
Correct.
Okay, because they're going to need some sort of follow-up care.
Exactly.
So that's really important to note. So does naloxone only work for opioid overdoses? Does it help with any other type of medicines?
No, naloxone will only reduce or reverse the effects of opioid medications. It will not reverse the effects of other benzodiazepines such as diazepam or clonazepam, or the effects of sedatives or alcohol.
Okay, so What's another word for those words that you just said? Diazepam, like, is there another, like, drug that we would know it by?
Oh, Valium or Alprazolam, Xanax.
Oh, okay, okay, so Valium or Xanax, if you know it by those names. So this will not work to reverse the effects of those drugs?
Correct.
Okay, but it also will work, like, if someone is on illegal drugs, right?
Yes, it will work for any type of opioid, whether it's legal or illegal.
Okay. And then probably you're wondering, how much does naloxone cost? So that's always, you know, a question when it comes up. So do you have any idea of how much naloxone would cost or how we can get it?
Yeah, so naloxone, the price of naloxone can really vary depending on the product you receive as well as the product covered by your insurance, if your insurance covers naloxone. You can always check with the pharmacy before you purchase naloxone to see how much the cost would be to you.
Okay. And then I'm aware that there are some community events out and about that's offered by the health departments and things like that in the community and mental health, resources. So you can always check for those kinds of resources where they're actually giving training as well as the product. So that might be another venue, and we'll try to include that in the comment section. So who should have the naloxone at home? So we kind of touched on this, but should everybody have naloxone at home?
It's really hard to pinpoint down exactly who should have naloxone at home. Like I discussed before, there are certain risk factors that put people at risk for an opioid overdose, including whether or not they've received an opioid before, how much opioids they've received, what medical conditions they have, and other medications that they're on. If you think that you or a loved one is at risk for an opioid overdose, you should discuss this with your physician.
Okay. Most important is having that caregiver go to the appointments
Correct.
with their loved one and have that conversation and try to have that open and honest conversation with the doctor.
Mhm.
Because, once you overdose and you're dead. So you need something that is going to help you in that emergency situation. So there's more information on our website, right?
Yep.
So what's the pharmacy website?
I believe it's on the
the100for.com/medication safety?
Yes,
Okay. And then I understand you have an event coming up at Eastern Market,
we do, yes.
right? So if you want to hear more information from Kristen and see the products and ask more questions, she's going to be there on March 9th at Shed 5 from 9 a.m. to 2 p.m. So you can come there and we will have more information for you. So most importantly, kind of to summarize, is that Narcan, Naloxone, Evzio, they all work on opioid overdoses, whether those are legal pills that you receive or illegal opioids, right?
Yep.
And that you should always call 911 if you think somebody has overdosed. Or if someone's passed out for any reason, right? If someone's passed out, they need medical attention. So that only makes sense for that. It could be any other medical conditions as well. Is there any other points that maybe we missed that you want to make sure that the audience is aware of?
No, just to have the conversation with either your physician or your pharmacist and get more information on naloxone and whether or not you think that you or a loved one is at risk for an opioid overdose.
Well, great. Thanks, Kristen.
Yeah,
You brought
thank you
so
for
much
having me.
knowledge on this topic. So this is a really important topic. And if you have any questions, feel free to put them in the comment section below. Or again, she will be at Eastern Market on March 9th at Shed 5. And we'll put all that information in the comment section below. Thank you so much.